I am so pleased to welcome Dr. Jill. Hi, Jill.
Sandy, I'm so glad to be here with you guys. Thanks for your patience.
I'm thrilled. And Jill, Patty will give a more formal introduction, but Jill needs no introduction. She is one of the leaders, one of the visionaries in this field of functional medicine. She has an inspiring story to tell, and she has a new book that I'm so excited to hear all about because we all want to support you and spread the word about your book. So welcome everybody, whether you're in the alumni program, you're a current student, you're thinking about becoming a student and joining this wonderful community of health and wellness coaches that are so badly needed around the world. And speaking of around the world, we do have a global audience. So let's get right to it. I am the founder of FMCA, along with Elise, who is with us as well in the audience listening in. And Patty Campbell has been with us since the beginning as a student. She has been our director of alumni development and strategic partnerships. And I'm going to pass the mic along to her so that we can begin the program. Thank you.
Well, thank you, Sandy, and both Carries for welcoming everybody. And it is my pleasure to introduce today's FMCA Ask the Expert, Dr. Jill Carnahan. And so I'm going to tell you a little bit about her. After completing her residency at the University of Illinois in family medicine at Methodist Medical Center, Dr. Jill received her medical degree from Loyola University, Strick School of Medicine in Chicago. She received her Bachelor of Science degree in bioengineering at the University of Illinois, and she is duly board certified in family medicine and integrative holistic medicine. She founded the Methodist Center for Integrative Medicine in Peoria, Illinois in 2009 and worked as the medical director until she moved to Colorado and opened a functional medicine consulting practice in the fall of 2010. She currently runs Flatiron Functional Medicine, a widely sought after medical practice incorporating a broad range of clinical services, including nutritional consultations, chiropractic therapy, naturopathic medicine, acupuncture, and massage therapy. As a survivor of breast cancer, Crohn's disease, and toxic mold illness, Dr. Jill brings a unique perspective to treating a variety of complex and chronic illness. She has traveled the world educating physicians on the principles of personalized and functional medicine. As a celebrated inspirational speaker and prolific writer, she shares her knowledge of hope, health, and healing live on stage, as well as through newsletters, articles, books, podcasts, and social media. And we'll link to some of that information so you guys have that as well. Dr. Jill has been featured in People Magazine, Shape, Parade, Forbes, Mind Body Green, First for Women, Townsend Newsletter, and the Huffington Post, as well as seen on NBC News and health segments with Joan London. So what that means is you guys can go to those sources and look at more of her work after the call. She co-authored the Personalized and Precision Integrative Cardiovascular Medicine textbook and is set to release her prescriptive memoir through Forefront Publishing in 2023. That book is called Unexpected, and we're going to discuss some of what is in that book today. It is available for pre-order, and I think it would make a great Christmas gift for somebody, so we'll link to that as well. Dr. Jill, welcome back to the Functional Medicine Coaching Academy community.
Thank you, Patty and Sandy. I love you guys, and I am always honored to be here. I've just followed all the work that you guys have done over the years, and you make my job and all the jobs of us easier to train. And I so often get asked so many times, what should I do? How should I become a coach? And obviously I refer them to you, and even my sister-in-law went through your program. And so I want you to tell you guys and publicly, I love you. I appreciate you. I am so honored to be here with you and so grateful for all that you're doing to really further functional medicine, because there's not enough physicians. We need coaches. We need this in our world. So thank you for the work that you guys are doing.
Oh, absolutely. And, again, thank you for all the support. And that, you've come and talked about so many different topics in the past. We've talked about very specific topics like mold and environmental toxicity and cancer and detoxification. And our AP members can check those talks out in the archives. But what I really loved about the book is that you focused on your story, both as someone experiencing illness, but also your story as a provider of functional medicine. So many have come to the FMCA community because of their story and their interaction with functional medicine and wanting to help others. So can you talk to us about the importance of knowing and sharing our stories?
Love this so much. And I'll tell you just a little background. I thought I was going to write a book about environmental toxicity. And then it became deeper where I realized, oh, it's not just environmental toxicity, but it's trauma and it's relationships. It's like all levels of toxicity. And we have to really address all those things for us to be well. So as I started writing, I realized though, as I was writing that the story, like you said, and every single one of you listening has a story. It's not just me. We all have our stories and they drive us to do what we do and to have passion about what we do and to become the healers that we are. And I realize story is so critical. And I know there's hundreds of books of my colleagues here that I love and so many of them that have changed my life. But there are some out there that you look at this 30-day detox or something. I'm just randomly saying that, no book in particular, but where you can kind of flip through and get the idea, but you're not like attached to that real, that relational connection. And the only way we do that is by authentically sharing our ups and our downs and our struggles and our fears so I really, as I was writing this, realized I have to be really real and vulnerable if I'm going to set the tone for all of us to be vulnerable and authentic in this world, because that's how true healing happens. And it doesn't happen just in the doctor's office or the office with your coaches. It happens on a coffee date with a friend or with your loved one when you're sitting in the evening and talking about your lives. And this connective tissue is telling our story. And it's only through telling the story that we find meaning and purpose. And my journey has been lots and lots of life-threatening illnesses and brushes with death. But every single one of those, when I started to realize, oh, I got breast cancer at 25, but instead of being like, woe is me, why is this happening to me? I shifted pretty quickly to say, okay, there's got to be meaning and purpose here. What can I do to find those pearls in the suffering and in the pain? And if we can teach and transform our patients and our coaches and our doctors to do that, all of a sudden, no matter what happens to us in life, that's what resilience is all about, right? Because my book is Unexpected, Finding Resilience Through Functional Medicine, Science, and Faith, and kind of this right and left brain and these sides of us. And telling our story is where it starts. So I had to model it. So all of a sudden I was realizing I'm writing a memoir. And I tell you the other story is I went to the publishers. I went through several different publishers until I found the right one. Every one of them said, Jill, you can't write a memoir. Nobody really knows you. And I know in our small little world I'm known, but not outside of here. It's not like I'm a famous celebrity or anything. And so I kept going up against the media and the publishers that said, you can't tell that you can't do this, it won't sell. And in my heart, and this is where if you're listening and you have a dream in your heart, you have an intuition about something and everybody tells you it can't be done, I'm here to tell you it can be done. And so I knew I had to write my story and I had to be very raw and vulnerable, not only in my own illness, but in my relationship, in my traumatic divorce, in some of my awful dating relationships. I go deep and I share it all, but I know that by doing that, hopefully some piece of it will connect with your story. And the real thing is it's not the secret. It's not even about me. It is. But what I want people to see as the reader is to see themselves in the story and see ways, first of all, hope. And second of all, ways that they can transform their own lives.
Well, your intuition was spot on, because as I'm reading it and, we have so many similar things that have happened in our lives that I was much were saying. So, and I think that everybody will also feel that as well. But yeah, that's wonderful. And you talked about in the book and just mentioned that we're not meant to heal alone, that we heal with support and in community. So can you talk a little bit about what that looked like for you and what you recommend for people who may be struggling with their help in terms of healing in community?
Yeah, so I grew up on a farm, one of five, and I was surrounded by boys, by brothers, and a strong kind of like German Swiss ethic, which was all about hard work, don't complain, don't cry. And now I know I actually am a highly sensitive, kind of creative, right brain person, but I was stuck in this engineering left brain, farm family and beautiful upbringing. And so it gave me strength and courage. And a lot of my resilience came from that. But what happened as a child is like, I didn't realize that like that vulnerability is our connection and to humanity, and that actually being vulnerable, which I used to consider a weakness is actually a strength. And it's that like saying we need help or connecting with others, like that healing comes in our vulnerability. And for me, because of that upbringing, I always thought I had to have it together. I had to know what I was doing. I had to be strong, that weakness was asking for help, all of those myths that we have. So when I started to relearn that and actually ask for help and let people in, and that was a big transformation in my healing. And I love sharing that because I think so many women who are professional, all of you listening, men and women, can maybe relate on some level because you're pursuing this stuff and you're strong and you're resilient, but actually saying, you know what, I need your help. Or even my first marriage, which ended in divorce, and we're friends now. But a lot of the dysfunction that happened with that was because we were both so strong, we didn't know how to ask for help. And I just really feel that learning that piece of vulnerability is the key to connection and also to healing.
Yeah, that reminds me of a section of the book that will work for love. And I think that this is a common childhood small t trauma that so many of us need to overcome, and that we have to learn that we're worthy enough just as we are, and transition to do things that are aligned with our true selves. And with that, you speak about flow as a healing modality. So can you talk a little bit about being curious and finding meaning and purpose and seeking mastery and autonomy, and how it related to that?
Sure. I love flow. I get so excited about this. If you're a dopamine driven kind of person who loves excitement and adventure, there's no more fun than understanding flow, because when you can harness flow in your everyday life, like that's when the magic happens. And if you're a coach trying to find, just like for me, trying to find complex solutions to problems, flow is where that magic, like Einstein and Mozart and all these people that created beautiful music and beautiful inventions and amazing things, they all harness flow. Now, flow can happen in many different situations. It happens on the threshold of something that's challenging for you, but not too challenging to be boring. So there's this like really important place here where we push ourselves a little harder. And it can be things like sports, like surfing or snow skiing or rock climbing or riding motorcycles or those kinds of things. But it can also be music, creating art, creating music, writing. It can be in nature, maybe when you lose yourself by a waterfall or walking alone with your pet. Or it could be for me in community or in social flow, when I'm with a patient and I'm completely present and I'm listening to their story. All of a sudden I have ideas about where the connections might be. And you guys as coaches could feel that too. So flow can happen in a number of situations, and you might be an artist or a writer, or you might be a aggressive sports person or a professional athlete, or anywhere in between. And you don't have to be a professional athlete. You can also be just a creative, and you can find for you what works. But like you mentioned, you finding your passion, your purpose, and finding where these kind of things coalesce. And especially if you have two things, like you love dogs or pets and you love nature, well, maybe you can do something, you want to find your talents and gifts in that place where those two or three things that you love the most kind of coincide, and find some unique place. And so that passion and purpose is important, because you have to be really ingrained, really entrenched in the process and be present. It's all about being present. You usually need a block of time of a few hours versus 30 minutes. So this multitasking or jumping from thing to thing won't get you into deep flow. And you might try something different or new, like dancing, take a dance class, take a drumming class. For me, I started coloring, like coloring books. I mean, get real. That's like a child thing, right? Now I literally in my car carry coloring books and markers and pencils. And if I meet a girlfriend for coffee, I'll often say, hey, do you want to color? And they mostly know me, but they might kind of look like, okay, that's a little weird. But you know what happens? It's magic, because as we're coloring, all of a sudden that childlike curiosity, which you mentioned, comes out, and we're having these deep, intense, incredible conversations. And part of it is because of the coloring, because it takes us into this more childlike, free state. So when we're children, we naturally have curiosity. Like I used to be like, Mom, this feels like a raisin in my ear. What is this? It feels like a raisin, that little piece of meat there. And so that curiosity is like, oh, there must be a raisin in my ear because it feels just like a raisin. And that's that childlike brain of like thinking outside the box. Like, well, of course there's a raisin in my ear. Well, nowadays as an adult, I'm like, duh, that's just flesh. That's not a raisin. But that idea, going back to our childlike curiosity, is like thinking outside the box. Nowadays, companies, instead of testing IQ, they're actually testing curiosity. And how they do that is they say, okay, here's a bottle of a jar of M&Ms. How many hundreds of uses or stories can you make up about this jar of M&Ms or some other random thing? And the way that we think outside the box is actually what gets us to solve complex problems. So even in the practice, I find if I'm curious enough about the patient and then listening carefully and being present, I can be in flow with them. And then all of a sudden that curiosity leads to new solutions and answers that I might have not thought of. So it all connects, and you can do something as silly as coloring or dancing, but going back to that more childlike part of ourselves will often enhance our productivity and our joy for what we do.
And curiosity is so important, especially if you're doing something like you have a health concern and you need to start changing, some things, or for anything really, you want to change your job or something like that. But really, when we're talking about, especially in this area, in something where a challenge that we might have, curiosity is so important. So thank you. And of course, our founders, Sandy and Elise, knew that flow is so important. That it's definitely part of the FMCA curriculum, is how to get in there. I love it. I had no idea, but that's awesome. Yes, yeah, absolutely. So, yes, and a lot of our coaches know that if they've already, or students gone through the program, that we talk a lot about flow. So, excellent. Thank you so much. So, kind of staying on that, and talking about childhood. How important was realizing and working through the subconscious messaging that you received in childhood to healing later in life? And maybe as a second part, what are some of the ways that these childhood messages set us up for disease in the first place?
Love this, because part of why I had to write beyond just cancer and Crohn's and gut and mold and those kinds of like real functional principles, like we all see them all the time, and they're so core with environmental toxicity and complex chronic illness. I wanted to go to this next level, because what I realized is after the divorce, it really caused me to become more awake, and it forced me, I'll say, it wasn't fun. It forced me to deal with the things. So when I was in this comfortable, I was almost 20 years married. And so I was comfortable in that situation. All of a sudden that blew apart. I was single, and I had to say, okay, who am I? What am I here for? What happened? What happened? And instead of blaming my ex-husband, who I certainly could have, he's not a bad person, but we can always do that, right? I looked at me. I said, okay, this happened. And how can I change? How can I grow? How can I become a better person because of this? And I went really deep, and I started to see patterns of dysfunction. One you mentioned, I think is relevant to any professional person listening here, is the work. So I sat in a Joe Polish seminar, and Joe talks a lot about addictions, and he's real passionate about this because he dealt with some things in his childhood. He'll share a lot about that. But as he started talking about addictions, I kind of tuned out, because I'm like, well, I don't really do drugs. I don't do alcohol. And in my mind, silly me, I was like, oh, I don't have any addictions. Well, he then went on to say, basically, all of you in this room, it was all health entrepreneurs and people like those of you listening. He said, all of you are addicts. He said, many of you who are successful have used work as your addiction. And I started to be like, whoa, wait a second, is he talking to me? And what I realized is this, and you mentioned this earlier, for me, again, I grew up I had wonderful, loving parents, so I never want to put any blame on them. But as a child, somehow I got the message that my value was performing, working, getting straight A's, going to school, going to medical school. Like somehow I got the message that my value was based on performance. And when that happened, then my love was equated to how I performed, how I did in school, what I achieved. And so then guess what? I achieved a lot. I just kept going to more degrees and more things, and added on the credentials and the certifications, because that was the way that I felt like I was valuable and that I felt like I was loved. And then I got married, and my identity was part of this, couple that was a wife and a mother. And also I was stepmom to 3 children, and then med student and doctor and all those things, those identities. But when that blew apart, I had to say, okay, who am I? What is my value? And when it first happened, I had this sense of like not being worthy, because I put my value, I'd hung my hat on the wrong hook. So I'd hung that on this performance. And what I realized was, even when we deal with trauma, if we are not aware of that, we can go. We can move, we can exercise, we can work, and never sit still or never slow down. Because when we do, if we haven't dealt with that trauma, what would happen to me is I was always moving. I never sat still. And when I did try to sit still before I dealt with that trauma, was I would get sadness that would come up, or I'd get fear that would come up, some emotion. I was like, wait, what is this? I don't know how to deal with this. And so I'd like get busy again. And so I realized with Joe's, kind of bringing that to the light, was for me, work was a way to avoid those difficult emotions. And because I grew up in a kind of a German Stoic household, we didn't share a lot. We didn't share anger, and we didn't talk about sadness. So I didn't really understand those emotions. And for 40 years, I had suppressed them. So how to heal? I had to literally get in touch with these emotions. I've done so many, you could name the therapies. I've probably done it, somatic-based therapies, trauma-based therapies. I've done them all, neuro-linguistic programming. And little by little by little, I opened up my ability to have anger in a healthy way and to feel sadness in a healthy way. And what happens if you've experienced this, you know what I'm talking about, because when that first comes up, and you can suppress it with meds, you can suppress it with work, you can suppress it with shopping, you can suppress it with eating, pick your drug of choice. And mine was work. And we all do it in some way because we all have little wounds and we all have a way that soothes. Some things are healthy. We might go out and make a green smoothie. I mean, that'd be a great way to deal with your stress. So it's not all bad. And even work is not bad. None of these things are bad. But what happens is when we overdo it and we suppress those emotions. And so in order to heal, and in order for my patients to heal, we have to actually be with ourselves and we have to be kind to ourselves. One of the biggest teachings in the book is how to teach your patients and how to teach yourself, because there's a sense of like, oh, shut up and be quiet and kind of suppress those pieces of ourselves we don't like. But when we actually allow them to come up, they're not so bad. And we can actually love all those parts of ourselves. And it's really this cohesive one of ourselves that we can show up better in the world when we are cohesive and we're able to deal with all those different parts and we're able to love all those different parts.
And suppressing that really does set us up, do you feel, as for some of those disease processes? As a functional medicine expert, is that, would you agree with that?
Yeah, let's talk autoimmunity, right? So, and let me just talk because I have breast cancer. So breast cancer, Gabor Mate and some of his research talks about this prototype. And many times breasts are a nurturing organ, right? I mean, that's how we nurture the world. And there's a definite metaphorical connection to being that you take care of everybody else, but you don't take care of yourself, or you take care of everybody else's needs, but you don't actually or ask or say that you have needs, because that's the vulnerability piece I was talking about. And you have to really, we all have to come to grips with that. I definitely did. The second thing, autoimmunity, is attack of self, right? Like a real level, we know this autoantibodies are attack of your own organs, but on a metaphorical level, it's self-loathing, self-hatred, and I'm not saying that everyone with autoimmunity has issues, but there's probably some piece in many autoimmune situations, there certainly was in mine, where you're not loving and accepting yourself completely. And in order to heal and go to the next level, yes, you can do low-dose naltrexone. Yes, you can heal the gut. You can do all those things. But what I saw was massive exponential transformation when I taught patients that they were valuable and worthy of love just for walking into the room or being themselves. They didn't have to do anything to be worthy of love. And that can literally shift autoimmunity.
Awesome. Yes. Thank you. Thank you for sharing that. That we've really been focusing on that mental, emotional, spiritual component, which is one of the pieces of the matrix. I know you had talked about it when you were on last a bit, and Patrick Hanaway, and how, that in terms, it really could be that piece, or that foundational piece, even beyond nutrition and some of our other lifestyle pieces. So yeah, thank you. And yeah, do you want to mention some of those resources in case, again, just in case of ways to heal in that area, so people can,
as far as
the neuro-linguistic programming.
Yes.
Yeah,
sure,
mind body.
yes.
Yeah. Mm-hmm.
Yeah. Okay. So things like emotional freedom technique, which is also known as tapping. That's a really nice one you can do yourself without a therapist. Here in Boulder, brain spotting is real popular. And I went to a brain spotting therapist, thought-filled therapy, which is similar to brain spotting, EMDR. Those are all similar. And the gist of most of those is somatic based. So instead of being like cognitive behavioral therapy is great, it's really good for OCD and certain things. It's not so great for these internal things in our bodies. So for me, I joke about, I was living above my neck up for the first 40 years of my life because I was super analytical and I would justify or figure out or whatever here in my head. But I kind of just told my body to shut up. I was like, shut up, be quiet, don't give me any problems. And I was very good at suppressing emotions, suppressing things that didn't fit. And I'll just tell you what's kind of funny. When I was like that, I was actually very, very productive because none of this like emotion got in the way. And when I started to do the somatic therapies, I actually started to feel again, and I started to be more human and more alive, but it actually was a little bit more disruptive to my, boom, 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 boom. And I had to be okay with the fact that I was slightly less productive, but way more healthy. And so there is this weird thing, because when we're just going and producing and working and we're not listening to our bodies, We can be very productive, but it's at a cost. It's at a cost. Other things, neuro-linguistic programming was really powerful. And there is, let's see, there's so many in that realm. Some of the leaders, I'm sure you guys have talked and read Peter Levine, Gabor Mate, any of these speakers and are excellent books in that realm. And even just limbic system training. So I always think of, like, when I talk about mold, limbic system is so huge, and I talk a lot about it in the book, because that limbic activation is the fight or flight. And if we don't address that as part of our illness, we get stuck and we can't heal because we feel unsafe. So feeling safe in our bodies is part of healing. So dealing with these things is so critical. And some of those things could be passively, like binaural beats. This is a way of listening to music with different hertz in each ear, and it's calming to the limbic system. Craniosacral therapy or lymphatic massage, or some of these things where you're actually receiving care or touch, can all be really powerful too. There's so many books out there that Norman Hodges, I think, has a book, many books too.
No, yeah, that's wonderful. Those are a lot of great tips and a place to get started. And thanks to the team for kind of capturing that and putting in the chat if you guys are curious and want to learn more.
Internal family systems I want to mention
yes.
too, because that's one really good. I'm sure you guys have talked about that. Mm-hmm.
Yes, awesome. Different parts. It's the parts work.
Yeah, parts work.
The book is great in highlighting that you can absolutely affect what is going on in your mind and body. That we have agency, and we do this through diet, movement, sleep, stress management, relationships, and the mental, emotional, spiritual piece that I talked about. These are all areas where coaches help clients create goals around. Tell us how that agency and making changes in those areas played a role in your story. And I know there's you have several throughout your life, but maybe highlighting a couple of where those kind of foundational areas that you worked on, how that helped with agency.
I'll give you two stories. One is actually the title of chapter 4. It's called Believe, Act, Wait. And I always say, you don't have to share my faith or my kind of belief, but I believe that we can all have that belief that something else is possible. And I talk about unexpected miracles as kind of part of the title. And once again, I define miracles to be, it can be completely agnostic. It doesn't have to do with a religion. It can be just something unexpected that you weren't, planning on happening in the way that was kind of I say magical, but again, if you're a real analytical thinker, you're like, Jill, that's baloney. But the truth is, like for me, okay, if I go looking for a parking spot, I always find good parking spots, but it's kind of because I'm just like, there's something going to happen here. I can't wait to see what it is. So this formula that I realized as I'm writing the book, if you're interested in writing for yourself or your story, I strongly encourage you to start, because as you write, it's actually part of the healing. So for me, this was part of that. But the Believe, Act, Wait formula, let me share that, because what I did is I wrote about my story and I realized, there's a formula here that I've used my whole life. And what this is, that I believe that something else is possible. I believe that, like, for example, breast cancer, I was told that I could die from this. Crohn's, I was told that was incurable, but I never took that for the truth. I believed that I could heal. I believed that something else was possible. And so many times in my life, I believed that something magical, miraculous was possible. I didn't know how. I didn't need to know how, but I believed. And then the act is the action. It's like you going to get coaching training. You're like, I want to help people. I want to be a healer. So you go to the institute and get trained to be a coach. And then that's the next step. Or you go get training for this, or you read a book, or you show up at this webinar. So you do the action of the things that you can control, or maybe it's your diet. You do something to change your diet or get good food in the fridge. So you believe, and then you act. And then there's a waiting piece. And that waiting piece is allowing the universe or whatever part of your life that can manifest, whether it's manifesting or belief in God or however that works for you. It's allowing for something else to happen that's even greater than maybe what you expected. It's leaving open-ended, like, I know I want this goal. I want to have, this house. I want to maybe be married, whatever kind of thing you have. You can believe for it. You do the action, and then you wait. And it doesn't mean you have to be idle, but you have this expectation of the how it happens is up to the universe, and you give that up. And then what happens usually, and for me, it's over and over and over again, something you never expected in a way that you never expected comes about. For example, 2015, I wrote in my journal, next year, I'm going to write my book and get it published. Here it is, 2023 is going to be published. That's a lot of years later, but I had to leave the how and something way better. What I didn't know when I wrote that statement in my journal was that I had to go through divorce. I had to go through some really, really abusive, difficult relationships, and I had a lot to learn. I had more chapters that I didn't know. And so I let that waiting happen, and it's the perfect timing. And in my mind, the perfect timing was the year 2016. So that's one example: believe, act, wait. And you can use that in your life, in your clients' lives. And the second thing is, how do we mindset our immune system in our bodies? And the example I give here is, I went through cancer. I fought cancer in one. I went through Crohn's. I fought Crohn's. I overcame it. I figured out the diet and the microbiome, and I won, and I cured myself from Crohn's. Then along came mold several years later, actually almost a decade later. And here I am, this invader into my system, affecting my immune system, causing massive inflammation and illness. And if I would take that analogy, if I'm fighting this, and mold, once again, I'm like, I'm going to fight this, I'm going to beat this, I'm going to get over this, right? But again, our mental imagery can affect our immune system. And in mold, what's happening is just like autoimmunity. My immune system was causing internal damage because it was trying to eliminate the mold and toxins. But that internal fight, if I use that same analogy, was actually causing terrible harm to my body, to my brain, to my immune system. And as soon as I realized that, I remember walking one day, and I just read a book about a guy who needed a bone marrow transplant for leukemia. And he told the doctor, he said, okay, I'm really good at visualization. How many blood cells do you need for the bone transplant? And he gave him a number. So he went to work every single day meditating on his bone marrow, creating enough cells so that the bone marrow transplant, it was an autologous. So they took his own bone marrow and then replanted it after they gave him a chemo to destroy his system. So he did that. The doctors took the sample and they were amazed. It was, I don't know, 100 or more times what they typically got. I said, what did you do? He said, I just visualized. And I thought, wow, if he can do that, so can I. And I realized that my fighting was causing harm. So I started walking every single day and visualizing, the little yellow minions in the movies. It's Despicable Me. So I pictured these little minions because to me, they're friendly, silly, happy guys. They're not fighters. And I pictured those guys as my immune cells. And I literally every day, I picture these minions. And instead of like fighting the mold and hitting the mold and getting rid of it, the minions would be like whistling, like, hey, let's escort you out of my body. And it was just like this happy, loving. And someone wrote this in the chat, love heals. I realized instead of fighting, if I fought and taught my body metaphorically to fight, I was going to get sicker and sicker and sicker. And I had to switch that. So this is, again, that mental attitude. So I literally started visualizing. That was when I started healing from mold, because I really trained my immune system to not fight, but to be this cohesive source of strength. And again, it may sound really silly, but it worked, and it worked for me. So
I mean, that's beautiful. And it's just as you talk about it, fighting feels one way in the body, right? And then the way that you just believe, act, wait, and I love the picture of the minions kind of goofily, expanding your immune system out. I mean, that just feels different, it feels good. It feels great. So I appreciate that visualization. And that's wonderful if we can help clients and patients do that as well. So yeah, that's wonderful.
And what you can do is you can ask them what would work for you, because for me that just happened to work. It might not work for you. Might be like, that's so silly, I can't even believe it. But you can check in with your clients, like, because I've done that with patients. I'm like, what would work for you? Is there anything you could visualize? Because our whole medical system, especially conventionally, is about fight. It's about, and you think about like during COVID, it's anti-infectious agent. But if we think about weight, our bodies are created to resist these infections. So it's a whole different mindset to think about healthy train and immune system versus just fighting, killing, giving antibiotics, giving antivirals. There's nothing wrong with that. It saves lives. But if we shift that mindset, we really have a lot more ability to heal.
And I think this kind of goes into this other part of the book that really struck me, that, you not going, I mean, you mentioned a lot of the things that you had to overcome by your early 40s. And then, you started dating after your marriage ended, and you learned kind of no matter what you've been through, there's still more to learn, and how do we cultivate that positive attitude and take the wisdom from those experiences, regardless of what we encounter in life?
Yes, I was just talking to a friend the other day. It's like, because I kind of think, oh, I've done this and overcome this, but then but wait, there's more.
Yeah.
I just encourage you, if you're going through, you just been through, and it always is this. Either you're in a difficult situation right now, and if you are, I'm sorry, and I love you, and I'm so glad you're here to listen to this and to share with this community. Number two, you've just been through something, and you're through it, and you're like, I just got it, or it's up ahead. Like, it's one of those three things. So if you aren't in a difficulty now, it's coming. I'm sorry, that's life, right? It doesn't mean you can't overcome it. But what happens is, as we have this attitude, it's that resilience that I talk about in the title. The resilience is this: if we know that, number one, we can overcome anything that comes our way. Number two, we can learn and get pearls of wisdom and grace and connection through these things. Like, there's something good in every experience. All of a sudden it starts to transform, and we're like, oh, what's coming next? Because we start to have the confidence that no matter what comes, we're going to be okay. That's a hard thing to learn. And I'm still in the process, just like you guys. But what I learned, like you mentioned, is things I thought everything. In fact, I wrote the book and I'm done. I'm getting ready to submit it. And all of a sudden, a massive fire. You guys heard probably about the Marshall Fire, went through my community, my backyard. I just about lost my home and my office in the Marshall Fire. Over 1,000 buildings were burned. My office was literally smack dab in the center. There's 3 different communities around that were burnt to the ground, all the homes, all around my office. I happened to be in Hawaii when the fire happened, and I looked back on the map of the fire, and I just thought, there is no way I'm coming home to an office or a home. They're gone. Like, I had to, and I'm saying that because I wrote the book thinking I've overcome this, I've overcome it. And all of a sudden I get done with the book and there's a fire that totally destroyed our community. And then my precious dog of 17 years died. And again, you guys, if anyone has pets, you get it. If you don't get it. But all these things happen. And just as I finished the book, the epilogue is it called Whatever Tomorrow Brings. It's about, there's going to be something else. But if we can harness these principles, it doesn't matter, because we're going to be prepared and have the resources we need to deal with the next thing.
Yeah, and the book does such a great job of that, of talking about that resilience and wisdom, and so I really do hope people check that out, not only to, it just gives you a feeling that you're not alone, because there are so many relatable pieces there, and sometimes when we're going through all the things that we go through in life, we can feel alone, but we're not. That, and especially in this community, I feel like we all bond over many things, especially functional medicine. And this book also has just all these great hallmark functional medicine resources in there that people can use to heal themselves. So maybe if you could talk to us a little bit for the work that you do, what are some of those foundational interventions that work best? Maybe some of the ones that you mentioned.
Yeah, I know you're talking like in like autoimmunity in general, or any specifics like are mold related.
Yeah, mold, you talk about that. You talk about just kind of general, like, how do you promote health, within the individual?
Got it. So, and again, this is so related to you guys and the work that you do, because first of all, the flow is relative, as we started, because being present with your client or your patient is the number one. So first of all, I literally created an office in Louisville where I practice, where there's real art from local artists. It's beautiful colors. There's no white, sterile cubicles. If someone walks in the door and we say, would you like something to drink? We bring out a glass of water in a wine glass. Like, it's simple, right? It doesn't cost any more. But there's this idea that I wanted to create a place where the client or the patient feels loved and feels special. Because really, truly, if I say there's one secret of my practice or success with patients, it's being present and loving them. And I really do love my patients, so that giving them a space where they can feel welcomed and loved. And then so many of our patients and clients have been traumatized, right, by the medical system. They've been gaslit, like especially complex chronic illness. They look at a basic panel of labs and they're told they're normal. So they've been told, and they're like, literally like, is this doctor, is this coach going to be just like the rest of them? Are they going to tell me it's all in my head, right? You guys know this, I know this. And so when we give them that space to completely be real and share, and we're present, we're not judging, and we're loving them, that's the true like secret to helping them heal. Because all of a sudden their immune system, their body feels safe, they feel heard, they feel like they can trust you. And it doesn't always happen the first visit. Sometimes you need a couple to get that trust, but that piece is the intangible that's not taught in medical school or coaching school or any of these things that, well, you guys teach it. I shouldn't say that you guys are teaching it here, but like at medical school for me, it was not taught. And like loving and creating space and presence for that person is the foundation. And then, of course, the practical things, like I do ask them about their childhood, their experiences, their relationships, and those things, just like we do a timeline. I actually care a lot. And as I hear them talking, you can often hear patterns of thinking like, oh, I've been so fat my whole life. I just can't stand my body. You hear those words and you hear, I can't stand my body. Makes me want to cry and jump across the desk and give them a hug and say, no, you're worthy of love regardless of your size. Like those are the kind of things where they like, and then sharing with them, do you realize what you just said? Like you are so worthy regardless of your size. Or maybe they lost their job and all of a sudden their identity is gone because their profession is gone. So listening to their self-talk, it'll come out in your interview. And if you can start to, sometimes it's just awareness, because most of the time we aren't aware of the messages we tell ourselves. So as you listen to them, you can hear these things and you can actually call it out and say, do you realize what you just said? And the most simple thing, I think, if it's a takeaway that you can remember, I literally take my prescription pad and I often write, be kind to yourself, because it's like, it's reminding them. I say, put this on your fridge, put this in your bathroom. The other thing, again, I probably shared this before in other interviews, but in my bathroom cabinet still, there's a little sticky note and it says, what does she need from me today? And it's just that reminder when I open that cabinet, because so often we're doing everything for the world around us, our family, our friends, our clients. And then sometimes it's just like, what do we need today? And it might just be like, I need a glass of water. I need to sit down for a minute. And it's like taking care of ourselves and that being kind to ourselves that can really transform your clients.
Yeah, that's absolutely beautiful. A beautiful way to be human. Well, gosh, I could say so many different things, but I know that we also had so many questions that were, that came in, and I want everybody here to have the ability to maybe ask something that's coming up for them. So I'm going to start with Jen, and she asked if you had a specific visualization phrasing you use around healing.
Mm-hmm. Well, just personally, I'll just share my experience. There's two things that really transformed for me. And they were also, again, after the divorce, what happened was I had this identity, it shattered apart, and my illusion of what was the perfect marriage, which it wasn't in reality, right? But I had told myself it was shattered. And my identity in that partnership was shattered. So I had to really refine myself. And part of that transition was retelling my story and actually finding things that worked, like the minions or whatever else. But one thing I did every day was I would walk, and I would say, every day in every way, I'm stronger and healthier, wealthier and more resilient, younger and more beautiful. I will overcome all obstacles. I will outlast all adversity. Things are turning in my favor. That was one thing. And I did that day after day after day, because what I knew is our subconscious will follow any programming that's repeated often enough that we believe. And even if at that moment when I started saying that, I didn't believe it, especially like younger and more beautiful, I thought, how vain. But I was like, gosh, I want to be younger and more beautiful. Why not? So and all those things over time, I feel like I am healthier and wealthier and more resilient and all those things. And the other thing I did was I created an alter ego. Now, this is interesting, because when we start to, I've heard, professional people who have stage presence stuff do this a lot. And I thought that's a really good idea. And what it is like calling out what we want to be, even if we don't feel like we're there yet. We all sometimes feel like imposters. And so what I did is like, I am Sasha, warrior princess, daughter of the king, worthy of love, full of joy, conquering all fear. And what I did is I put in joy, love, avoiding fear, or conquering fear, and all of those things. And my faith is in there too. And later I looked, and you know how sometimes we write vision statements or mission statements and we put like core values. I did not know this, but by doing that, I am Sasha, warrior princess, is my alter ego, because she's stronger than me. She's braver than me. She's a little smarter than me. And I kind of visioned, I want to be this person. And I named it. And then all of those values, love, joy, peace, and my faith. When I went to later write my mission statement, every one of those four things are my core values. And I didn't even know it, but I was literally reinforcing my core values as I said that. So those are some of the simple things you can do. And you can make your own, you can write your own of how you do that, of how it looks, but it really does have a powerful effect on our identity.
Yeah, that's great. One of the concepts that we talk about because a lot of coaches talk about imposter syndrome, is we talk about the concept of as if, and acting as if we are. And that sounds a lot like Sasha, the warrior princess.
Yes.
And then the first part was just a lot of that loving kindness meditation, it's not very much. So, and that's just a time tested wonderful way to, to be kind to ourselves and work on ourselves. So yeah, that's beautiful. Thank you. See if we have, is that affirmation in your book? I don't think so. You guys got it special just for being a part of today.
You did.
So,
the first one is not, the second one, Sasha's in the book, and the other one is not. So yeah.
Yeah. Oh, and thank you for joining us from Israel. It's 2 a.m. So, I'm glad you woke up too and are with us. Thank you. So we have a couple of specific questions because you are very much known in the biotoxin environmental illness world. So if you can answer the question, what's your opinion of detoxification protocols for mold illness? Are you in favor, and what would you recommend? So we know that you're in favor of that. So can you tell us some of your favorites?
Yes. So obviously mold and mold toxicity are increasing issue. You guys are seeing it everywhere, just like me. So liver, gallbladder, pancreas, this whole axis in a right upper quadrant biotransformation is core. And the very basics are anything that increases glutathione. It could be something as simple as NAC or vitamin C, glycine, glutamine, lipoic acid, milk thistle. You're supporting that liver to produce more glutathione and to do its job of phase 1 and phase 2. And what that does is transform these toxins into a water-soluble agent that can be stuck into the bile, and then the bile is excreted into our gut. And it's excreted into the gut, but the enterohepatic recirculation is incredibly efficient, which means we reabsorb the biles very efficiently to recycle them. So what you need to do is break that cycle. It's actually too efficient for toxicity, and you use binders, clay, charcoal, glycomanins, chlorella, and prescription binders like cholestyramine and Welchol. And these are all charged particles. They all have slightly different affinities for different toxins, and they will actually escort out the bile with the toxic load through your stool. So that pathway is number one. Number two is lymphatics and doing anything you can to support lymphatic drainage. I love dry brushing, lymphatic massage, hot cold therapy like hydrotherapy or cold ice baths, or cool showering off before you get out of the water, Epsom salt baths, coffee enemas, castor oil packs, all these things that are very naturopathic in nature, they work and they're really important. Infrared sauna is really key because that's getting that sweat out through your tissues. But the core, if you think about it, mobilization and excretion are what you're looking at. Mobilization, I think, is quite easy. You give more glutathione, you do more saunas. That's easy, and you can do it by giving pills or saunas or things. But if you mobilize them too quickly and they're not excreting, like the lymphatics are sluggish or they're really toxic, they get sick. And we've all seen that happen. So this mobilization plus excretion is where it's at. And if you're mobilizing too much and you're not excreting, that's when they get sick. Excretion is more difficult because it involves dry brushing, or it involves lymphatic drainage or homeopathic remedies, or some of those things that are a little bit more gentle. And you have to have the excretion in order to keep up with the detox.
All right, awesome. Thank you. Is there another, you're always on the leading edge in functional medicine. What would you say is kind of the newer concepts that are coming out that, maybe that's good for coaches to keep on the forefront of their mind?
Good. Well, have you ever heard of long COVID? Right?
Yeah.
Like, oh my God, I'm being silly, right? But I think that we are on the edge of a tsunami, and here's what I'm seeing, and this will frame it for you guys and how you see it. When you've seen chronic fatigue or Lyme disease or mold-related illness or Epstein-Barr reactivation, you guys have seen these kinds of things, and these are stuff we kind of know when we treat these complex chronic. Long COVID is another situation with another virus that does similar things. It's not that different from what you've already done. So even though it seems new and scary, and there's a lot of people who are having symptoms of, long COVID, I think they said 30 million people, and maybe 1 in 8 or 1 in 10. I can't remember the exact number, so don't quote me, but there's a lot of people who are experiencing this. So we're on this edge, and you guys as coaches are going to be on the forefront of being able to lend some advice to this. So I framed it that way. And then here's the pattern that I see either post-COVID or long COVID, or people who are struggling after they get sick. Number one is their B cells are more activated. This means they're more prone to autoimmunity. So we are going to see an increase in autoimmune disease, I have no doubt. Number two, T cells will often diminish for a while. T cells fight viruses and they fight cancer. So I think we're going to see a lot of reactivation. You've probably already seen, I know I've seen in my practice, massive amounts of young people and people who shouldn't be getting shingles are getting shingles. They're getting Epstein-Barr reactivation. They're getting all kinds of old viruses. Even now with the flu, it's going around. So it's almost like that T cell arm of our immune system is a little more weak. So these old viruses and things are popping up. And even someone who had Lyme and maybe was under control, that could pop up again as an old infection if the T cells are diminished. Also, cortisol is being affected in a lot of patients. So I'm seeing a lot more flatline cortisols, low cortisols, adrenal issues, hypoadrenia, and not always to the extent of Addison's, but is significant enough where they're really, really exhausted. And if you kind of know those patterns, then you can look at it and say, is there any autoimmunity? Is there any viral reactivation from T cell dysfunction? Is there any, percolating cancers or reactivation of cancers? And how is their adrenal function? And that gives you a little framework to deal with long COVID in a cohesive way.
Well, and that while that, is unfortunate to hear that COVID is doing that and long COVID's doing that, hopefully coaches are hearing that you're, with that amount of people that you are needed, and that working with a functional medicine provider to help support patients in those areas that coaches work, which is lifestyle modification. I think that, there is need, there is need for you.
Oh,
for sure.
True. 100%. And someone just mentioned this is also a piece of blood viscosity. Yes, the blood is definitely, it's kind of like babesia, malaria, some of these other illnesses we've seen that affect blood viscosity. Definitely not 100%, but I'm doing hyperviscosity panels of, protein C, protein S, and all the different fibrin and D-dimer, because I'm seeing a lot of blood dysfunction as well, clotting risk, clotting issues. So that's important to be aware of as well, 100%. So thanks for mentioning that, Sharon.
Yeah, wonderful. Thank you. Well, I think this book, thank you so much for being here. And I think this book is going to be an excellent resource for functional medicine coaches, not only for the functional medicine resources, but also, again, I had said what was so important was your story, and that we all have a story. Yes. And many of our stories are similar, and there's healing in knowing that, and knowing that we're not alone. And that we have community. We have community here in FMCA, IFM, all of the great providers that are there. So thank you so much for your wisdom, your work, and all the wonderful things that you're doing in the world.
You're welcome. And I do have a special gift for you guys. So I have the first chapter free for anyone who listens at all. It's totally free. And you don't even have to buy the book. You just get this free. I'm going to put it right in the chat. You can share it with everybody. It's just readunexpected.com, free chapter, free for all of you guys. And the other thing is, if you've already bought the book, so thank you if you just go to readunexpected.com, that's the main landing page. There's like 4 free bonuses. I've got a free secret chapter that I didn't put in the book. I've got a lecture on MCAS and mold that's free. And I've got a coloring book, a coloring journal, so you can color and write. So all those things are your gifts. And for you guys just here today, I have the free first chapter. And thank you so much for having me and letting me talk about it.
Yeah, no, thank you for being with us. It's always a pleasure. We hope that you are going to be back again as well.
Yes.
Thank you so much. Patty, thank you for excellent moderating. Thank you for everybody who showed up today, who came around the world and stayed up all night to be here. Thank you all. We appreciate all of you. This is such a loving community. For those who are new today and just joining, I hope that you will stay with us, because what you heard tonight, this is not new. We have Dr. Jill coming back. She's a part of our community, and you will get that love and support. And Jill, thank you so much. I learned so much, and you are a coach at heart, because what you are doing and your interventions will give you an honorary coaching certificate for you. You are a coach, and so we're really appreciative of you. And
let me just say again, you guys are doing such important work, and you guys who are listening are doing don't give up. Don't lose heart. You are so needed in this world. And I am so grateful to be here, and I feel honored to be here, because I feel like this is the future of medicine, what you guys are doing and teaching. So thank you.
Well, thank you.